commonest things that you'll get is like wrist and shoulder pain. That's like a strain from either practicing too much, or doing it in the wrong position. Let's just say that it's just something that you have to deal with, and you're just like, this is something I'm never going to stop playing my instrument, and I know that this is going to happen. I used to have a really bad wrist problem because you're going like this with your violin hand and you're sort of pushing it out all the time. What I'm getting at is if you do certain other things with your hands and they're already inflamed, you can be scared to think, oh, what if it gets inflamed even more and I won't be able to play my instruments? That's what I would kind of worry about. So in today's video, we're going to be talking about acupressure for musicians' injuries and people that might have RSI, right? So repetitive strain injury. So these are things that might happen to your wrist or to your shoulder or things like that. Now, firstly, you need to seek the care of a practitioner. If you're not already, don't use these exercises and these techniques if you haven't already sought that help, because the practitioner might not want you to do these kinds of things because sometimes they can flare things up more or stimulate things that they might be, trying to treat you in a different way. So make sure you would get your advice from your practitioner whether you should do these kinds of things before you start. But these are exercises I would often give to my patients who I'm treating to do in between the acupuncture treatments. So the commonest things that you'll get is like wrist and shoulder pain. That's like a strain from either practicing too much, like overuse, just playing too much, or doing it in the wrong position. And that could be something where you might need to seek the help of someone else that can help you with the flow of how your instrument is and things like that. But let's just say that it's just something that you have to deal with, and you're just like, this is something I'm never going to stop playing my instrument, and I know that this is going to happen. Or you've just had a really busy time of it, so you might have done a lot of gigs or done a lot of practicing, and you're just noticing that you're getting a flare-up. So the first thing you can do is what things are around the house, the coat hanger method, as I call it, on your gallbladder 21. So what that's going to do, even if you've got pain or tightness in your wrist, is it's going to stimulate blood flow through your shoulder. And you've got two main channels that we're kind of thinking of here that interact with each other. So your gallbladder channel is what we're stimulating. I'm going to stop pressing that because it's going to make my voice go funny. It feels so nice. Your gallbladder channel is what we're stimulating here on this point, and it's really just in the top part of your shoulder. I'll show you how you can find that in just a sec. And then what you can do is go down your arm on the outside, so what we call the yang channels, or the yang aspect, the outside of your body, going up and down like that. And it's just very simple to do that. And that shouldn't stimulate your the wrist pain. Like let's say you have wrist pain, it shouldn't stimulate that too much. So the next thing you can try is you can try massaging different points on here that you might find are tight. Now, often the tight points is on your large intestine channel. So large intestine 10 is a big one, right? So it's right in the height of the muscle there. We just kind of massage up and down that area. And you can use the gua sha method or the scraping method. The other things you can do is just kind of massaging like across the channel. So in Chinese massage, they call this tan bo, this method, right? Which like strumming. So if you're a muso and you're watching this, you kind of understand what I mean when you're kind of strumming across the muscle. So you'll feel it like the fibers of the muscle going this way. You're kind of strumming across it this way. And you can do it very lightly, and then you can press harder and harder as you need to. What you should feel is an achy or tingly in your hands, and that means it's working. What you shouldn't feel is it being so sore that you can't then play the next day properly because you've pressed too hard. Now, practitioners may treat you like that, and I do treatments on people, and I'll say to them, look, this is going to feel very sore the next day, but you're kind of judging that based on what people have to do and what their commitments are and how bad the problem is and all this kind of stuff. And like that, but as a self-massage thing, you shouldn't be pressing it so hard that you're like, oh well, I can't do this. Like 5 or 10 minutes a day is enough to kind of do a treatment on yourself. Now you can do it several times a day if you need to. I would normally recommend a shorter amount of time, more frequently, rather than like think, oh, I'll give myself some self-massage once a week for an hour. That's probably too much for this kind of thing. So why are we doing it like this? Because what you're trying to do is reduce the buildup of fibrous tissue that happens from that overuse. That's simply what you're trying to do, and get more blood flow in there. When you get more blood flow in there, then your body's doing the exchange of all the stuff that comes out of the tissues when you're overusing or overworking an area. It needs that blood flow to kind of be there. And how do you know there's blood flow there? Well, one is it just feels warm. Like it should feel warm after you've done this. So it should feel a little bit tingly, a little bit warm, not painful. The pressure that you're using on yourself should be, you know, nice and kind of relaxing and that kind of thing. But don't discount using this on your shoulders to help with your wrists. Like, this can really help. And certainly if you have shoulder problems, or if people play guitars and they're using straps on them. I've had several patients that have been bass players or guitarists that just, their problem is not so much the playing, it's the heaviness of the guitar being on there all the time. So it depends on your posture and how you play. And, you know, some people just want to look cool when they're playing and they don't think about their posture too much. But that's probably for another video to kind of talk about posture and stuff like that. So what you can do is you can use these coat hangers to get in on those spots yourself, right? Because we're talking about doing self-massage. And what then you're doing is you're going between the shoulder blade, which is the bony part, and the spine. So your spine's right in the middle and your shoulder blade's just off to the side. So your shoulder blade is obviously bone, it's a bone, and it hurts if you press on it too hard. So if you're using this and you're pressing and it's hurting, if you're got really thick muscular kind of structure, maybe it won't hurt you too much. Muscle tends to hurt a lot less than fat. So if you're overweight and you're pressing on fat, that hurts a lot more than muscle, but bone hurts the most. And you can bruise yourself if you press on bone too much, right? So I'm not into saying press, this isn't very hard, this is very light. I wouldn't press too hard on the neck, like just very lightly, maybe hardly at all, because you don't want to damage or hurt, you don't want to hurt your head or your neck. So this is more for between the shoulder blades, like what muscles wise, we're talking about the rhomboids. So that muscle that goes between your spine and your shoulder blade. And that's the one that you use when you're kind of typing a lot, you're doing this action, right? So you are stretching that out a little bit, but it's when you're hunching and you're on the phone, or you're just kind of hunching up, or on the computer, or looking at devices, you're kind of hunching all this area. So what acupressure is the best for is doing short bursts of it regularly through the day to stop the tension kind of building up to the point where you'd need to go and get a treatment to do it. So what you want to do is keep one of these hanging around. Now, recently I was at my band rehearsal and I started hitting myself with a drumstick, because when I'm not singing the songs, sometimes I play the cowbell. That's my other job. And so someone gave me a little drumstick and I was playing the cowbell in my band. And then I was like, oh, drumsticks are really good, like similar to this, right? Same kind of thing, right? So in this video, I want to share with you things that you might have hanging around the house. So if you don't have a coat hanger like this, you don't have any wooden coat hangers, you could use a drumstick, but you probably don't have one of those hanging around the house. So you might have another kind of stick. You might have something wooden is definitely better than something plastic, because it's got that give and that bounce into it. So these kind of like, this is a very thin paintbrush. Now you could use this very lightly for these kind of things, but it just doesn't feel as good as the drumstick or the coat hanger thing. But this is a technique of what we call tapping or hitting method. You can use your own body as well. And this is called bird pecking method. So what you do is you make your hand like a little peck, bird pecking. And the techniques of acupressure are always the best if you have a loose wrist. So I don't expect people to kind of get this straight away, but this loose wrist kind of action is what's, you know, when you're doing rolling, or when someone's doing any kind of what's tuina, which is Chinese massage, that's how they get feeling good at it, like by keeping your wrist loose. So if I have a stiff wrist, which means I'm not sort of letting my wrist kind of flex up and down, then this will hurt a lot more because there's less give. It's exactly the same as with this thing being bouncy. There's a give in it because your wrist is kind of pecking up and down. So what you're supposed to do with this is actually get a little sound. So I'll do it for you, and it doesn't feel that comfortable to do it over and over, but kind of like this. So you can hear that little tapping kind of sound. If I don't do it hard enough, it's not really getting that sound very well. It's hard for me not to do it properly because I just know how to do it. And what you want to do is, when you've done it, like even that time there, if I press on this again, it almost feels bruised in a way. It's not bruised, but it feels tender and sensitive. So that's all you need to do. You don't need to keep going. So what channels would we use on this area? So you want to do the yang channels, which is the outside of your body. So either you could use the stick thing to get on the outside of your shoulders, do your shoulder blades and the back, right? You can use this to get right down, or you can use the drumstick or your wooden spoon or something like that you've got around the house to kind of get right in there. But on your arms, these channels relate to your neck and your shoulders as well. And especially when you're on the computer, right? When you're on the computer, you're sitting a lot, so you're compressing your lower back. We'll talk about that in a minute. But you're also you're just using your hands all the time for different things, and all the tension can kind of cramp up in your hands. So there's a lot of good ways you can kind of release that and stop that from becoming a problem. And one of those things is to do acupressure down the channels. So what we're going to talk about first is which channels you should use. So how are we going to find those? One is if you, again, feel the bone, you'll feel a little depression sort of here at the front. Again, if you're in the wrong spot, it doesn't really matter. It's not a big deal. But this channel this is your large intestine channel, and it's not, in this situation, it's got nothing to do with your intestine. So it's just a naming system for this method purpose, right? But it's just this is the channel that's going down your forearm. And the main points that you want to use, sometimes people use this point, Hergu, large intestine 4, and then all the way through your forearm at the front here. So if I just kind of bring my forearm here and I do this, you can kind of, I'll trace the channel up here. So the height of this muscle here, right, in this muscular part, that's what you want to do. That's what you want to do. Now you can just use the banging method and go down your arm. So very lightly, much more lightly than what I was doing on my neck, and I'm doing it a lot more heavier on my back, but just very lightly, kind of up and down. So any kind of stick, kind of doing that. And what you should feel after doing it is a tingly, like a nice sensation, and your hands should feel a little bit tingly. Why are they feeling tingly? Because you've just stimulated all the blood flow to kind of get to those areas. And that's all you'd need to do. So this hand feels really nice, whereas this hand now feels a little bit tight. So now I'm going to go and do this side as well. So you don't need to do this for very long, just a couple of minutes. And what I used to notice when I was traveling to China quite a lot is Chinese people just know this stuff instinctively, and they call this their Qigong or their Tai Chi, and they either do this when they're doing their exercises, but they will do this as part of their exercise routines. But they also do this at the airport. Like they've got weird little sticks and things that they're kind of, people are shuffling around, hitting themselves with these things, just instinctively knowing how to do this stuff, because you're going to get on a plane, you're going to sit there for hours and hours and not move around and have all that stagnation. So these are the kinds of things you can easily do. Now, another thing you might have lying around, you may not, is a Chinese spoon. So we're going to talk about a little thing called gua sha, or spooning, as it's sometimes called, or scraping, and how that fits into this kind of massage. So what you're doing is you're stimulating the channel, right? And some practitioners do this on you when you go in there. You might have seen it done on people before, like a style of Chinese medicine called cupping, which is where we use fire or sometimes use a suction pump to kind of get the air out of a cup and place that on the skin. I'll show you a video while I'm talking about this, of how that works. So what that does is it leaves a bruisey coloured mark on the skin. There's a video that I did with one of my colleagues, Jeff Brothers, and we were talking about what's the difference between cupping and acupuncture and that kind of stuff. So you can check out that video on the channel if you're interested in knowing more about cupping. So cupping's little friend is gua sha, right? Which is the Chinese method of, like, it's kind of also in between self-massage, something you do at home, something practitioners can do. Even I've seen it employed by other practitioners that are not Chinese medicine practitioners. It's a folklore kind of thing that's been used. So what you would do is, I'll show you with my hand first. So when is this really useful? For people who use their arms a lot for things. So let's say you're typing all day and you've got RSI, or you've got problems with your wrists, like carpal tunnel or something like that. Now you can use your thumb, just the edge of your thumb, the bone. So I'm using, like, scraping along with the bone. And what I want to show you is how that's already a little bit red on there. Right, so it's getting red where I've rubbed it. And what will happen with the scraping, so I can continue to kind of do it with this, is it'll get red and it'll get to a bruisey coloured mark. Now I'm not using any oil, but you can use oil if you want to. So here we keep going, keep going, keep going. So you can kind of see that line there where I've been doing it. Now this is your large intestine channel, okay? So you don't have to go all the way from your thumb, but just in this bulgy part of the muscle here. And we're just kind of doing this. Now that's enough. You don't need to make it bruisey coloured. You don't need to make it a bruise. What will happen is if I keep going more than this, my arm will actually be sore all day long. for the rest of this day, and then tomorrow will probably feel good again. And that can be good if you've got stagnation, you've got knots, and you've got old tissue that you kind of want to release and things like that. But if you do need to rely on your hands to keep doing things, so I've used this a lot for musicians' injuries. I've used it for myself when I first started playing the violin. Well, not when I first started, so I was 4 years old then, but as years went on, I used to have a really bad wrist problem because you're going like this with your violin hand and you're sort of pushing it out all the time. And it just used to be so sore. And actually the thing that fixed it the most was doing doing Chinese massage. It used to be so sore that I couldn't drive my car properly. Like if I had, because this is my gear stick hand, if I had to use a gear stick, it was so inflamed that I would, have it bandaged up. I'd have a wrist strap on it and things like that. And I used to use all kinds of Chinese medicine on it then because I was studying Chinese medicine. And I remember going to China and doing this. I really, really wanted to learn Chinese massage. And I was kind of a bit worried. Like I actually did bring my violin to China that time. So I think I was still committed to playing it. I don't think I played it very much in the hotel where I was. It was kind of, I don't know, I just felt like lonely if I didn't bring any instrument with me for 3 months being in China. But anyway, that's another story. So wasn't like needing to play it. Like I wasn't committing to playing my violin at that point. Like I was just like, I brought it there for fun. So what I'm getting at is if you do certain other things with your hands and they're already inflamed, you can be scared to think, oh, what if it gets inflamed even more and I won't be able to play my instruments? That's what I would kind of worry about, right? If I do this treatment on it, what if it gets worse? Now, sometimes it does get a bit worse before it gets better. What I found with the Tuiner is initially, so with Tuiner, you're doing a lot of this movement, like a lot of this rotating. Okay, so you're doing either rolling, you're doing these kinds of things. And I was expecting, because with normal massage, you're putting a lot of pressure this way with your hands. And even if I do that now, it hurts. Like if I push down on this hand, it hurts a lot more than this hand, right? Because this wrist, I guess if I kept on doing that all the time, it would probably flare up again. But I haven't had that RSI problem, like that repetitive strain or that. When I went to a doctor, he just said, tenosynovitis, which is like inflammation of the tendons and the synovial joint. And that's usually what happens before you get to carpal tunnel syndrome, right? So often before that, you'll be diagnosed with tendinitis, like an inflammation of the tendons. So what I'm getting at is I was worried about going to do all this massage because I wasn't sure exactly. I'd never been trained properly in Chinese massage, done a little bit of it before I'd left Australia. But I was doing like 6 weeks intensive of this massage as part of my 3 months in China. And initially it did hurt. My Chinese massage doctor used to tell me, go home and soak your hands in hot water as a treatment to stop the pain that was happening from doing this intense massage, right? Because you're just doing it all day long for 8 hours a day. So what I was saying is that movement is what fixed it, right? Being able to do these rotational movements and having that flexibility in your wrist. And what makes it worse is when you're in a position, so this happens a lot. I see this happen a lot with people who play the guitar or play bass, particularly bass, because you're kind of really having this joint flexed like this, right? Like really flexing it. And then you're doing these dexterous movements with your fingers. So what you're doing, it's really an awkward position. So, part of me getting better with my situation was learning how to play my instruments better, right? Not having awkward positions. And I looked into Feldenkrais, which is a style of movement-based kind of therapy. And I never went and saw a practitioner of it, but I was looking into kind of how they were doing that. And so doing what you're doing over and over as part of a flow rather than it being a static thing is an important thing. But the problem with a lot of stuff that we do, instruments are a little bit different because they can sort of flex and move a little bit. But often those things are static. Now we're moving, but those things are static. So this kind of movement of your body versus the non-movement of the structure is something to kind of think about when you're thinking about how can I recover from like an RSI kind of problem. So getting back to the self-massage, right? So if you've got a serious problem, you've already got a diagnosed condition or something like that, then seek help from your practitioner before you do these techniques, because they might be taking you through a certain kind of treatment where they don't want you to flare it up or they don't want you to do this. But if your practitioner has said to do these kinds of things, then these are the sort of exercises, the self-massage exercises you can do. So what I would suggest you do is, firstly, number one, don't press on bone because it's going to hurt. and you've got more of a chance of bruising your body, especially if you're using something like this. So right in the middle here, that's the gallbladder 21 point. That's the main point you want to use. And then stay on the outside of your body. That's the yang area of your body, not the inside of your body. Now, you're not probably going to hit on your chest with this kind of thing, but the outside, the back of your body, and not the inside of your arm. So even with carpal tunnel, like the problem is with the median nerve, which is, you know, on the medial, like the inside of your body, you would still do the massage on the outside mostly when you're doing that self-massage. The large intestine channel and your gallbladder channel and your Sanjiao channel, they're 3 channels that you want to kind of focus on. So I'll pop a little thing up on the screen so you can kind of see where they are. But when you're looking up these things, because you might go on Google and look up where are these channels, these are the kind of things you want to focus on. Now, when you find an acupressure point, how do you know it's working? How do you know you're on the point? So it should feel like a kind of a tingly, achy, heavy, a numbness feeling, a bloated or distending feeling sometimes. So let's say we use this point here, Hergu, large intestine 4. A lot of people would say, oh, that's painful, right? It's not pain like someone stabbing you, like a sharp stabbing pain. Now, from acupressure, just pressing the points, you're unlikely to kind of generate a stabbing, achy, intolerable pain like you sometimes can get from acupuncture. It's not common, but that can happen. But when you're pressing on the point, it's got to do with how much pressure you put on. So if you're pressing on points on your face, you just have to press very lightly, like you hardly need to press on them at all to get to stimulate the same thing. And sometimes with acupressure, if your body's a little bit more deficient, actually you don't need to press as hard and you can still get that sensation. And you might find that one side of your body is like more sensitive than the other. That's very common. So you might think, oh, when I press this point here, wow, that's really strong and I've hardly pressed it. Whereas this point I'm like pressing and pressing and I can't really get that same feeling. So that's acupressure, right? It's the pressing of acupuncture points. That's all it is. So one is you've got to have the right point location. And secondly, you've got to press it with the right amount of force or in the right direction to get that feeling. So what you can do is you can think about your body. So let's say on the shoulder, you're in this little crevice here, in this depression. You just want to press in and sort of press this way a little bit, press that way a little bit, and see which way you kind of can feel, oh, that's a little bit more stronger. And sometimes you can even move your own body towards the point. So if I put my finger here and I move my shoulder towards the point, I'm actually increasing the strength of what I can feel. So I hope this video has been useful and helpful to you. And if it has, make sure you leave a comment or share it with a friend. I'm a practitioner in Perth, Western Australia. So if you are in this neck of the woods and you want to come and see me, you can check out my clinic. And you can make an appointment with me, and that's what I do in my clinic. I see patients and help them with either acupuncture, I give them self-massage techniques like this, and I do Chinese herbal medicine as well. So I hope to see you again on the next video soon, and happy playing. Good luck with your with your self-massage.